WHO is also watching the situation in the United States closely. It said that the Omicron variant sweeping the US at the moment is the most transmissible subvariant so far, but they're not seeing any change in its severity. Dr. Craig Spencer is an emergency medicine physician and associate professor at Brown University School of Public Health and joins us now. Dr. Spencer, it's good to talk to you. Tell me this, if outside of China, in countries like the UK and the US and indeed Europe, where there has been a big vaccine rollout, why are people still worried about COVID coming into the country?
Well, the reality is that as we've seen with this newest variant, it continues to evolve, and there is concern that a variant could emerge that would be more immune evasive, that could undermine our vaccines, or could be completely different than what we've seen. Even here in the US, we continue to have, hundreds of deaths every day, and again around the world. We've seen rolling waves for the past couple of years, and even if a lot of people have moved past it and gone back to normal, people working in emergency rooms and hospitals, as well as people who are older, immune compromised, have to worry about COVID every single day.
So telling people they have to test before coming into a country, that kind of tightening of travel restrictions, does that help, do you think?
Well, depends what the purpose is. If the purpose is political action to make it look like you're doing something, sure. Does it have any meaningful public health impact in terms of preventing variants from coming into the UK, the US, or other countries? Absolutely not. We've learned this throughout this pandemic, throughout previous outbreaks of respiratory viruses, H1N1, SARS, and really over the past 100 years of seeing viruses move around the globe. Modeling and real-time experience shows that you would have to completely shut off travel in and out to delay, that doesn't mean you can stop, but to delay importation of a viral variant for perhaps days, perhaps weeks. So we know that testing by itself a couple days before people come in, or even once they come in, is not going to prevent the importation. And if you look right now in the US, we have a lot of uncontrolled spread all over the country. We have rising admissions, rising case numbers, some of the highest hospitalizations that we've had, since early 2022. So we already have uncontrolled spread. I don't think that any more cases coming in from anywhere else, unless they're a significantly different strain of this virus, is going to have any meaningful impact on what's happening in this country or many other countries.
So how likely is it that if the virus is allowed to spread in any way in a country like China, that we'll see new variants that could potentially be more severe than the ones we've seen already?
There's certainly the possibility, but the variant that we're most concerned about right now, this XBB.1.5, developed here in New York and is spreading in the Northeast and has potential to spread more broadly. It already appears to be on the upswing in places like the UK and will have a global presence soon. It's already in dozens of countries. Does that mean that we couldn't get a new viral variant out of China or somewhere else that couldn't be more concerning? By no means, no, but we already have enough virus circulating. And since the last year, really over the last year, since Omicron was really first identified in late November of 2021, Omicron has been dominant. This newest variant we're talking about now in New York and the Northeast of the US is an Omicron lineage. So we're seeing things kind of related to Omicron, even if they're taking the worst bits of different parts of it and getting a little bit worse. We still know it may be more immune evasive. It may spread a little, better than previous versions of the virus, but we don't see, as of yet, any change in terms of the severity of disease or ability to undermine our vaccines.
Dr. Spencer, thanks for that. Let me bring in the panel. Joel, Dr. Spencer says that stopping people from coming in without a test is a political thing, but does it make you feel better to know it's happening or not?
Well, Miriam, if there's anything we've learned over the last 2 years of COVID in the United States is that it is a very political issue, and it's not just a medical one. So yes, it does matter to have good politics on this. And this means good politics means ensuring that testing is underway, that we are watching those who come in and doing our best to prevent import of people who are infected. And then B, not doing what the Trump administration did, which is to pan an entire country and foment a sort of Asian paranoia of Asian travelers to the United States, which has led to a rise in hate crimes in the United States. And I think the Biden team should be commended for making it clear that they want China to be more transparent, to work with the WHO, to work with our experts, to test people to ensure they're not coming in, then, of course, the big one here in the United States from an American perspective is make sure that people get vaccinated to mitigate any risk of harm if they do get caught, if they do get COVID.
And of course, Rebecca, we're talking about this because of the recent outbreak in China. What kind of an impact will it have now on global trade and what's happening globally with the economy if we see China now miring itself in a COVID disaster?
Well, I think there are real economic risks from all of this. And I think the problem that we have is that China has only just reintegrated itself and opened up post-COVID. So obviously during COVID, we saw a lot of supply chain issues because of the fact that Chinese manufacturing slowed down. Now they're beginning to see the effects that we've all seen across Europe, across UK, obviously, and in the US. As economies open up, as people start to mingle, they get sick. And as they get sick, they start to take time off work. And the Chinese PMI, the Purchasing Managers Index, which is an index of how much is being done in manufacturing in a particular economy, has been going down for the last 5 months. And it dropped particularly severely in December, just as the economy was picking up. Now, there was a lot of market hubris around China coming back into the global economy and opening up again. The proof will be in the pudding. If Chinese manufacturing slows, then that's going to create supply chain issues again.
Let's take it back to medicine now with you again, Dr. Spencer. I'm interested to know this. People talk about wearing masks, bringing mask mandates back. How effective would it be, do you think, in stopping these rises in the numbers of those with COVID in the US and the UK and those kind of countries to bring back some sort of mask mandate in certain situations?
I think that despite the partisan bickering over the past couple of years, we know the science and we know that masks work. And in certain circumstances, obviously, they should be used. I wear a mask whenever I work in the hospital, and we know that for high-risk populations, they can be truly a lifesaver. It's not just COVID at this point either. Look at what's happening with the swirl of respiratory syncytial virus, RSV, influenza, which is hitting our pediatric population particularly hard. We know that masks can help in all of these circumstances to help lower the transmission of respiratory viruses, especially at a time when all three of these seem to be circulating in really high numbers and putting a lot of pressure on healthcare providers and healthcare institutions here in the US and in many other places.
Okay, Dr. Craig Spencer, good to talk to you. Thank you very much for that. I want to bring